Hey guys, Dr. Lester here, and I want to have a quick overview of hyperglycemia versus hypoglycemia. So we're still talking about blood sugar, whether it's too high or too low. Now, there is a long list that I have here of the symptoms and side effects that you might feel if you have each one. I'm going to read them and then I'm going to try and sum it up for you in a way that makes sense, okay? So for hyperglycemia, which means it's like you have too much, it is dizziness, blurred vision, frequent urination, most people know about, increased thirst, fatigue, headache, cravings. You get hangry. You definitely can't miss meals without feeling like you're not feeling good. You have fruit smelling breath, so it's a very sweet smelling, nausea, dry mouth, diarrhea, weakness, confusion, and eventually, if it gets bad enough, coma and death if you have too high of a blood sugar. So when you think of too high of blood sugar, I want you to kind of think of like being too hyper until it like, everything is wound up, right? So if you're too hyper, then I'm moving too much. So I'm going to be exhausted because now I can't stop moving, my vision might be blurry. I might be dizzy because my head's going all over the place. So that's a good way to think about it. I might have a headache because I'm shaking my head around. I don't know. This is how I think of these things. I'm moving a lot, so I'm going to be thirsty. So I'm going to keep drinking a lot of water, but because of all that water, I'm going to have to pee a lot, right? So those two things are covered. And I'm probably going to be hungry. So I need that fast sugar to make me feel like I'm not hungry, so I'm going to have crazy cravings. And if I don't get enough food, then I'm going to be hangry. I'm going to be like, I need to eat because I'm moving all the time, right? And sometimes I might be eating the wrong things because I'm just like shoveling food in because I'm moving too much, so I might have diarrhea. This is how I think of those things. I know it's kind of crazy, but hopefully it will help you remember that hyperglycemia is like everything's moving. We gotta like bring in more food. We gotta bring in more water. We're shaking it all up, and now I'm exhausted and right? So that's hyper. Hypo is going to be an increased heart rate. It's going to be fatigue. You're going to be pale, sweaty, shaky. You might have anxiety. You're definitely going to be hungry, right? Irritable. You might have like tingling or numbness going on in your face, which is kind of interesting. Vision problems again. And if it gets really bad, like seizures, confusion, and loss of consciousness, and of course, coma. So, when I think of low blood sugar, I think of like I didn't eat enough food, so now I'm just so exhausted. I'm definitely grumpy because I'm hungry, and I'm exhausted. Everything hurts. I just want to eat. I just want to complain about not eating, and I'm starting to get shaky because I don't have any blood sugar, so I'm just like, okay, like I can barely move. Give me, so it's like all of this effort to move. And so I'm getting shaky and my heart's starting to beat quickly and shortly because it can't take like big deep beats because it doesn't have any food. So it's just like, all right, well, we'll just kind of put in a half-ass effort, right? So I see them as just kind of like half-ass efforts into all of these things, and I'm sweating doing half-ass effort because I haven't eaten and I'm hungry and I'm fussy about it. That makes sense. So hopefully that helps you think about them a little bit. I think it is important to have an idea of which one you are experiencing when you are managing some of these blood sugar issues. So that's why I'm kind of trying to share them and give you very visual examples of them, so you have an idea when is the problem that my blood sugar is too low, or is the problem that my blood sugar is too high. Do I need to take my insulin medication, or, well, if you listen to my insulin one, or just, take a supplement to help, or eat something, or whatever. So what is it that I need to do based off what I'm feeling? And in lieu of, if you have a glucometer or something to read it, then that would be extra great. But if you don't have that, knowing those symptoms is super helpful. I hope that helps, guys, and I will see you in the next one.